Okay, great. I guess we'll get started. You guys are probably tired, I'm sure, but I hope you've had a good week so far. So the lecture should be a little bit lighter this morning. We're just going to focus on what data science is like in healthcare, and I'll give you mostly examples. So today, what I want to cover is why would it be important to work in healthcare? Why might you be interested in doing this? Why is data science interesting in healthcare? So what are the key challenges? I'll illustrate that through a couple of examples of problems people are working on right now, and then I'll just close with how I ended up working in healthcare. And then we might have time for some questions at the end. But just like Monday, feel free to put questions in the chat or turn your mic on, very flexible. So let's start with why work in healthcare. So I think the first point is sort of very obvious to most of us is that improving someone's health or the care that they have could actually lead to improvement in their life, right? How healthy we are really affects how we live our day-to-day lives. And this is just a recent article from the MIT Technology Review. I'll post my slides after, and all these blue underlined text are links so you can take a look. Highly recommend you check out the MIT Technology Review. It has lots of easy to read articles about like recent advances in healthcare. This is just one of them to give you a sense. This is about robot assisted surgery for patients with breast cancer. So oftentimes after women have breast cancer surgery, they develop a condition called lymphedema, which results in swelling of the arm. So it can be like really debilitating from day to day. But the surgery to do it is like highly precise. So you need a very skilled surgeon to do it. So by teaching a robot how to do it, you could potentially expand who gets the surgery and who could have some improvement in their day-to-day life. So this is just one recent example of how technology can move us towards better healthcare. The second is that there's actually a long way to go in understanding what it means to be healthy. So the classic definition of health comes back to 1948, so a very long time ago, and it's defined as the complete physical, mental, and social well-being. But as you can imagine, like our world has changed. So our ideas of physical, mental, and social health have changed. We also know there's like a lot of variability in how patients respond to treatment or what physical health is for one person versus another person. We can also measure each of these types of health, physical, mental, social, in different ways than we could in 1948. So for instance, on Monday, I gave you an example of a smartphone study where we looked at mental health outcomes that didn't exist in 1948. So there's a lot of work we can do in trying to answer questions about health in the modern world we live in today. And that's related to the third point of why work in healthcare is that it's like a really data rich field. There's a lot of data, a lot of place for data science to potentially help out to help us better understand health and improve healthcare. So a long time ago, health data mostly came from research studies. This might be something like recruiting patients with a specific disease, giving some of them a treatment, some of them a placebo, and seeing if it works. So just a traditional sort of clinical study. But as time has progressed, our idea of health data has really changed. So for instance, we have things that can measure someone's environment, like smartphones or wearables. We have different measures of someone's social health, like how they interact on social networks, what is their internet usage like, as well as more modern health data. So I'll talk about electronic health records today, as well as medical images. We also have like tons and tons of genetic data. So there's a lot of space for data scientists like yourself to work in healthcare. But as we saw on Monday, that just because we have a lot of data doesn't mean we have a lot of answers. And particularly in healthcare, data science is very challenging. And there's been a lot written about this. So this is actually the work of Heather, who we met last week during one of the lunchtime sessions. And while there's been a lot of application of AI in healthcare, many of the algorithms actually aren't used in the doctor's office. So when you go to the doctor, you aren't seeing somebody typing in, characteristics about you and spitting out something about your health, right? We aren't quite there yet. And there's many reasons for that. One of them is that being responsible with machine learning, AI, data science, and healthcare is very challenging. We can go back to our lecture on Monday, right? Like even if you build a highly accurate algorithm, if you have a rare event, you could end up with a lot of false positives, right? That might lead to people getting treatments they don't actually need that could cause them harm. So it really takes a team of people, data scientists, clinicians, policymakers to do data science and healthcare correctly. And more recently, there's been an article written about really the technical challenges. What makes machine learning or AI in healthcare so challenging? And we'll talk about these issues today through some examples. But to understand the challenges, we can go back to this picture you guys have seen all week about like the general formula for a statistical learning or machine learning problem, where essentially we have a data set. So here we have something in tabular format, right? We have information on the features X, the outcome Y. We use those examples to estimate some learning algorithm. And then with that algorithm or model, we can take a new observation of X and get a Y, right? Just a prediction problem. But in healthcare, it's this whole process has challenging. Each step is hard. So for instance, the data itself is typically extremely messy. So it's not like some of the nice data sets you've seen this week. Uh, Oftentimes there's lots of missing data. So in electronic health records data, for instance, you might have data just from one hospital. So if a patient goes outside of that hospital, you may miss a clinical event they had or a treatment they received. The data itself is also extremely noisy, like taking health records again as an example. Like think about the way your doctor writes notes about you. You can hardly understand, right? It's very messy text. Similarly with mobile health data, like we have different types of phones, which leads to all sorts of noisiness in the data. The data itself is usually very heterogeneous. So we could have text data, we could have sensor data. We need to figure out how to reconcile all these different forms of data. The data itself can also be incomplete, right? We might want to understand something about mental health, but we might not have the environment of incomplete data. For instance, we might not have environmental factors we need or social factors we need. So there's many challenges in healthcare that we face just at the data level. When we get to the learning algorithm, we actually have problems sometimes even building a model. So things like data privacy come into play. You might have data from multiple hospitals, but you can't share the individual level data because of patient privacy reasons. So how could you build a model that only shares certain summaries about the data to jointly estimate the model? Computation is also a huge issue. In health data, there's lots and lots of free text, which requires huge amounts of compute, which is extremely challenging. Also in health, if you're going to build an algorithm that doctors use, they often want to know why it's making the decision that it's making. So you want an algorithm that's what's called interpretable. I can understand what are the factors that contribute to its decision. Though I will say in machine learning and health, there's a lot of argument about the necessity of interpretability, but we won't get into that. And once you have a model, sometimes you even get to this last step and you want to think, is it clinically relevant? So are the predictions I'm making actually useful to a doctor? So we saw an example of this on Monday where you might be predicting mortality, but every patient that you give the doctor is on end of life care. It's not really useful to them. So you might have an accurate model, but it's not actually clinically relevant. And something we also talked about Monday, we'll talk about more today, is bias. So actually your algorithm might not be making decisions that are equally accurate for different subpopulations. So you're inducing some harm by doing that. And so to